A busy day for Minister Dr. Zweli Mkhize. His first stop, Richmond Hospital near Pietermaritzburg. A 95-bed facility was handed over to quarantine COVID-19 patients. The minister was impressed.
Key issue here is to look at whether do we have enough beds available, do we have enough oxygen available, do we have enough staff available, do we have adequate management capabilities to be able to deal with these issues, and do we have other equipment, ventilators, PPEs and so on, and do we have good enough arrangements of communication between staff and management and unions and management, because that's a kind of combination that you need to actually manage a proper response.
Dr. Mkhize later visited Clarewood Hospital in Durban. It's one of the biggest COVID-19 facilities in the province. It's anticipated KwaZulu-Natal is to peak in a few weeks' time. The province is on standby with 16,000 beds in different facilities. 90,000 positive cases have been recorded so far, with a recovery rate of 60%.
There's a risk that we can still have an upsurge. That upsurge can be worse than what we have seen already. We've seen those trends in the US, we've seen those trends in other parts in Europe. Everywhere where there's been a loosening of the containment measures, we see that the viral infections start spiking and going up. So we are going to be starting to look at how to recommend to the Coronavirus Command Council what steps need to be taken now that we are seeing these trends. But what we need to really be very careful about is that we can't suddenly say that everyone must open up. There must be big meetings, there must be big rallies, there must be big weddings and big funerals and so on. That's a very risky area that we must really say. We will really plead that there must be an understanding as we deal with this matter.
And a call for the sickly, especially the elderly, not to delay going to hospital. High number of infections has been attributed to non-adherence to COVID-19 regulations. Vusi Khumalo, SABC News, Durban.